In drawer 3, you have all of your intubation supplies. This drawer contains, first of all, various sizes of ET tubes. You also have a collar to secure the ET tube once the patient has been intubated. We have laryngoscopes, as well as the bases for the laryngoscopes. And just of note that these are now disposable, both pieces. We also have tape and benzoin in case the patient needs to have the ET tube secured in that manner. There's lubricant here as well. We have our Co2 Director. So this is a very important piece of equipment because this is how we ensure that the ET tube has gone into the right place on the patient, and this needs to be documented on the code sheet. We have a non-rebreather mask. Over here we have several sizes of OPA as well as an NPA. You have stylets in the back. So just remember, when you grab an ET tube to pass to the physician, you also need to pass them a stylet. We also have a tube that's called a bougie. So this is used to help replace the ET tube when one has already been inserted. You can slide the new ET tube over top of this and it acts as a guide into the airway. We have some Mcgill Forceps. There's also another set of combination pads in here that will allow you to defibrillate the patient. So please remember that if you don't see them on top of the crash cart, you don't need to go hunting in the clean utility room. They are always contained in drawer 3. There's also some suction kits in the back in case suctioning needs to be performed. Lastly, in drawer 3, you have more ECG electrodes. Additionally, you have more respiratory equipment back here other than in drawer 3. So we'll go through everything that's in this bag. First, we have your ambu bag. So the ambu bag sits in here. It's very important that we take that out and start giving 100% oxygen to the patient as soon as possible when we identify that they have coded. You also have an extra pair of the combination pads if they're not in the binder and you need access to them quickly without going into drawer 3. There is suction tubing and a Yonker suction. And then we have this suction bridge in here as well, should it be needed.